Hello. Today we're going to be talking about the formation of an abdominal aortic aneurysm, also known as a AAA. So just a quick outline of what we're going to be talking about. We're going to go through the introduction to the disorder, then we're going to talk about the different risk factors, then we're going to go deep into the mechanism of action, then we're going to discuss the dissection, which is one of the most fatal outcomes, then we're going to speak about the implications and significance, and finally we're going to wrap up with the treatment. So just a quick introduction to aortic aneurysm. It's classified as an abnormal dilatation of the aorta, and abdominal aortic aneurysm specifically refers to the portion of the aorta that's affected. So as you can see, the distal portion of the aorta below the diaphragm is the AAA, and above the aorta, the proximal portion would be thoracic aortic aneurysm, or TAA. And AAA is usually asymptomatic. As much as 75% of cases are asymptomatic, and of the 25% that do experience symptoms, it's usually back pain or pain in the abdomen or a pulsing sensation near the navel, and it's usually diagnosed by aortic diameter. So an increase from the normal aorta to 50% would be classified as an aortic aneurysm. And one of the most fatal outcomes that can occur is dissection, which is when the aortic aneurysm ruptures. And that has a fatality rate of up to 90% because of the severe hemorrhaging that occurs and the inability to quickly address it or get to a hospital in time to fix it because it happens within minutes. So some of the potential risk factors that are prevalent in AAA are older age, male gender, some different hereditary disorders such as Williams syndrome, smoking, unhealthy diet, obesity, and atherosclerosis. Okay, so now we're going to talk about the development of AAA. So if you look at this figure on our right, this is a nice flow chart that kind of just shows you how the different factors that we're going to talk about in terms of development of the AAA. So we're going to start with talking about damage to the media, then we're going to talk a little bit about atherosclerosis, then we're going to talk about medial neovascularization, and we're going to finish with inflammatory infiltration. So this is a nice reference guide that you can look at to help understand how the different players intermix and affect each other. And this figure on the left is a great depiction of what a healthy aorta looks like. So you can see what healthy remodeling looks like. So you can see the MMPs and the TIMPs, which we'll discuss later. And the overall aorta has the same size, the same distribution of layers. And then in the adverse remodeling, you see the layers are a lot thinner, there's a lot less tensile strain in the aortic wall, and this is what leads to the formation of the AAA and potential rupture. Okay, so the first step in the process is damage to media, and this is defined as the smooth muscle cells, which are located in the media, and they produce matrix metalloproteins, MMPs. And MMPs have a direct regulatory function on matrix remodeling. The different risk factors that we previously mentioned and atherosclerosis damage the smooth muscle cells, which affects the cell's ability to properly remodel. And if we look at figure 5, figure A is showing the VEH, which is the control with the freshly isolated smooth muscle cells. B is showing the collagenase with the control. C is the control with the elastase. D is the control with collagenase and elastase. And then E is the most important figure. We're looking at the smooth muscle cells in the healthy aortic tissue versus the AAA tissue. And as you can see, the cell number is decreasing over time in the aortic tissue, in the aneurysmal tissue, so which leads to this damage to the media. And if you look at this figure on the right, A and B are depicting healthy media structures, and then C, D, and E are damaged media structures. C and D are in TAA, and then E is in AAA. So as you can see, there's a lot of holes, a lot of gaps, and you can see the clear damage to the media that's occurring. Okay, so next we're going to talk about atherosclerosis. So it's a little unclear if they AAA and atherosclerosis are linked or if they just have similar mechanisms, but atherosclerosis precedes AAA in a lot of cases. So we're going to talk about it a little bit. So these various stimuli, such as modified LDL accumulation for atherosclerosis or smoking for AAA, all produce these different myeloid cells. Well, activate these different myeloid cells, which release different cytokines and chemokines, which activate T cells and create a different inflammatory response. So if you can see the healthy aortic tissue, they have very few chemokines and cytokines. And if you look at the AAA tissue and the atherosclerosis tissue, they have a huge plethora of these different cells, which are leading to the inflammation. But they're pretty much identical except for the presence of foam cells in the atherosclerosis tissue. Next, we're going to talk about medial neovascularization, or MNV, which is classified as proteolytic degradation of the cellular matrix by the cytokines, which leads to progressive cell wall weakening. And these pictures are from an article that was describing the microstructure and mechanics of AAA. And as you can see in the first picture, this is the intima, the media, and the adventitia of the aorta. And this is just all of it together, and you can see it's very cohesive, not very many gaps. And then if you look at the AAA tissue, there's a lot of gaps. These are two different pictures right here, and they all have a lot of just gaps and degradation present in the AAA tissue. This is another figure from the same paper, and it's just a nice summary to show you the stress levels within it. So if you look at the media, the adventitia, and wall, obviously the media has the most strength normally, but it's still significantly less than the amount of tensile stress that's present in the AAA tissue, especially the circumferential circumferential tension. And then for figure 3, this is from an article that was about the histology of AAA, and it's showing the infiltration of the vasovasorum into the media, which disrupts the media structure. So as you can see in A, all of the vasovasorum is underneath the media, and in figure B, the vasovasorum is starting to infiltrate the media, and it's starting to push, if you can see. So that's disrupting the matrix. Lastly, we're going to talk about the inflammatory infiltration for the mechanistic part of this presentation. So inflammatory infiltration is the proteolytic